Thank you for your interest in the Family Engagement Quality Improvement Project Implementation Guide, an online guide developed by the National Center for Medical Home Implementation, or National Center. The National Center is a cooperative agreement between the American Academy of Pediatrics and the Maternal and Child Health Bureau and the Health Resources and Services Administration. The National Center conducted a nationwide family engagement improvement project aimed at enhancing shared decision-making and connection of families to appropriate supports and services in the pediatric medical home. As a result, this web-based implementation guide was developed. This implementation guide provides tools and resources needed for implementing family engagement quality improvement projects in clinical practice or through multi-site learning collaboratives. Materials may also help individuals, organizations, or groups interested in applying for Maintenance of Certification Part 4 credit for a family engagement project. All resources are customizable and free to download. Let's begin by navigating to the Family Engagement Quality Improvement Project Implementation Guide webpage. To access the Implementation Guide, hover over the Tools and Resources tab in the navigation bar. Select the link for Family Engagement Quality Improvement Project at the bottom of the drop-down list. The landing page provides an overview of the Family Engagement Quality Improvement Project and shows an expandable list of the sections that are available in the implementation guide. By viewing all the implementation guide sections, the user can decide to follow the sections of the guide in the order they are listed or skip to a particular section based on what they think might be useful to them based on knowledge, needs, and priorities. The implementation guide is divided into 8 sections. The sections include background and project overview, project planning, learning sessions, action period, post-implementation, lessons learned, results, and acknowledgments. By clicking on each section title, you can access tools, resources, and documentation associated with that topic. Now let's navigate through the sections of the implementation guide. Let's begin with the background and project overview section. In this section, you'll find an overview of the project, the definition of family engagement that was used, as well as top resources developed for the project. Next, the project planning section. In this section, you will find all of the materials and documentation required for creating Institutional Review Board, or IRB, and Maintenance of Certification Part 4, or MOC Part 4, applications. All materials within these sections have been de-identified. The section also includes sample materials that can be included in the appendices for both IRB and MOC Part 4 applications and utilized through the project's implementation. These documents include the project's aim and measures, recruitment materials, data collection tools, and parent-caregiver partner job descriptions, among others. The FEQIP Change Package is an essential resource developed for this project. This document provides practical resources and strategies to plan and implement tests of change related to family engagement. Sample PDSA cycles are also provided throughout. This project brought together core improvement teams for 2 in-person learning sessions. These sessions provided education around family engagement and time for teams to engage in collaborative learning and to plan tests of change. Within the Learning Sessions section, you will find resources that can be used for planning and implementing 2 in-person learning sessions. Sample learning session agendas and agenda book materials are available for direct download from the website. Presentation topics are listed, and individuals interested in obtaining copies of specific presentations can email medical_home@aap.org to request presentations. National Center staff will respond to all technical assistance requests within 1 business day. One component of both learning sessions was the opportunity for participating teams to create storyboard presentations. These are presentations through which project practices can share information about their teams. Teams share information about their practice, patient populations, and desired outcomes and challenges throughout the project. Templates for storyboards are also available upon request from National Center staff. This project consisted of a 6-month action period with 6 one-month data collection cycles. Each month, practices tested interventions that had the potential to improve family engagement through the use of Plan, Do, Study, Act, or PDSA cycles. Teams collected monthly data, completed monthly narrative progress reports, and participated in monthly education calls and webinars. Within the action period section, resources to support implementation of PDSA cycles can be found. The links within the change package provide tools to assist with planning PDSA cycles or tests of change for each topic area associated with the project measures. Sample PDSA cycles are also included. Monthly education calls and webinars were implemented throughout the project to provide education on a particular topic related to family engagement. They also provided an opportunity for teams to discuss progress on related project measures. Presentation topics for each educational webinar are listed here. If you are interested in obtaining copies of specific presentations, you can email medical_home@aap.org to request them. Each month, teams completed progress reports on additional information related to their family engagement activities. Templates for progress reports and monthly webinar evaluations are available for download here. The post-implementation section includes resources to support project evaluation. The post-implementation survey and qualitative interview guide were used to collect data from practice teams and parent caregiver partners. The lessons learned section provides an overview of important insights from the project. The Enhancing Family Engagement Through Quality Improvement fact sheet provides further details about the project's recommendations and lessons learned. The results section provides a summary of the project's measurable impact, including a 77.8% increase in knowledge reported by participating teams. Aggregate run charts, as well as the project executive summary, are included. The project was supported by funding from the Maternal and Child Health Bureau of the Health Resources and Services Administration. The Family Engagement Quality Improvement web-based implementation guide provides clinicians, Title V and Children with Special Healthcare Needs program staff, families, and others with the tools, resources, and strategies needed to enhance family engagement. National Center staff are available to provide technical assistance to individuals interested in planning and implementing family engagement quality improvement activities. If you have any questions about this implementation guide or need technical assistance, contact National Center staff at our email address, medical_home@aap.org.